He is with the SIU Center of Family Medicine. Doctor, good morning to you. How are you?
Good morning. I'm fine. How are you doing?
Fine, thank you. Tell me what your practice is, what you single in on, if you will, over at the SIU Center for Family Medicine.
So at the Family Medicine Center, I do practice primary care, like most primary care physicians do, but I also specialize in sleep medicine. So in addition to that, I treat sleep disorders such as insomnia, sleep apnea, restless leg syndrome, nightmares, sleepwalking, sleep talking, and such sleep disorders that exist. And I focus on trying to help patients treat their sleep disorders along with their other medical conditions like diabetes, heart failure, COPD, and hypertension, and kind of help give them a better health quality altogether.
Doctor, is there one common denominator why people have difficulty sleeping at night, or are there many reasons, as there are people who are bothered by not being able to sleep?
There are many reasons. There's not one denominator that is common. People can have problems falling asleep, or they can have trouble staying asleep. And both of these things have different factors that play a role into it. Now, the most common aspect in most people is poor sleep hygiene. Now, we're very, unhealthy with our sleep habits. Most of us consume caffeine in different forms, such as, sodas and stuff for dinners or late in the evenings, and that has caffeine in it and stays in the body for about 6 to 8 hours, and it affects the time you go to bed and also sleep quality throughout the night. Some of us, have unhealthy eating habits, so we eat spicy food, fatty food that kind of cause heartburn and make it difficult for us to sleep pleasant at night. We take daytime naps, which also hampers our quality of sleep later on. We spend too much time in bed not sleeping. That prevents us from falling asleep easier. We stay on our phones, we watch TV, and interact with other blue light devices that hampers the release of melatonin in the body, and that also hampers our quality of sleep. We don't have a set routine most of the times, or we worry too much about sleeping. So these sleep hygiene affects a lot of our sleep quality and in our ability to fall asleep. But apart from that, there could be other sleep disorders that are going wrong, such as sleep apnea or restless leg syndrome. This causes us difficulty to stay asleep, so we wake up multiple times throughout the night. And some people may have a delayed sleep phase. They may have circadian rhythm disturbances because they do shift work, so they work during the day for a few days and then at nights for a few days, and that also disturbs the circadian rhythm and makes it difficult for us to stay asleep or fall asleep.
Let's talk about melatonin. Is it an effective aid to help people sleep? What do you think?
It depends on what's going on. Now, if they have a circadian rhythm problem, yes, melatonin can help them. If they have a difficulty falling asleep, in some cases, yes, it can help them. But not all of the time. It all depends on what the factor is that's playing a role in the difficulty to fall asleep or stay asleep. So we got to narrow that down and then treat it accordingly.
Let's talk about some of the prescription drugs. Tell me about Ambien. Is it controversial? Can people OD, get hooked on Ambien? What makes it such a talked about drug?
Again, like Ambien, yes, is one of the hypnotics. It could be addicting. It is a good sleep aid. It is easier to get approved by some insurances compared to the other drugs that are out there. And there are other drugs that are better out there, but the insurance companies will obviously give us a hard time. But anyway, like I said, it all depends on what's going on. What is the factor behind the difficulty to fall asleep? Is it anxiety? Is it pain? Is it a sleep disturbance? Is it restless leg? Whatever's going on. So Ambien is not a one drug treat all kind of deal. So we have to kind of narrow it down. Now, most of the prescription drugs that are prescribed with trazodone and Ambien, because a lot of people think they are blanket drugs and can help, but really there are a lot of drugs out there, and it all depends on what really is going on with the patient. So a really good sleep history is important. Understanding the factors involved in the sleep disturbance is important. Is it really a sleep disorder? Like if it's a sleep hygiene, it's not really a sleep disorder, it's a behavioral problem. So you have to improve the behavior, the sleep behavior. Now, the most common effective treatment for insomnia is CBT, which is cognitive behavioral therapy. So that's not a prescription drug. It's mostly a behavior-targeted approach to treatment.